The independent commission, which looked into the deadly spread of COVID-19 in Ontario long-term care homes, confirmed what advocates have been saying for well over a year. Ontario didn't have a plan to protect long-term care residents, which is why nearly 4,000 of them died. The province does say they are doing much better now, but advocates disagree, adding urgent action is needed.
Everybody was vaccinated, I believe, about a week or so after he passed away. So that really bothered me too.
London resident Jeffrey Hancox lost his stepdad to COVID this past January. He was 82 years old. While Ed Rutherford had health issues, Hancox believes he would still be here today if he didn't get sick at a nursing home in Listowel.
I saw a lot of neglect there myself when I visited him.
His story is relatable to hundreds of Ontario families. A 322-page report from the Long-Term Care Commission, issued yesterday, states many of the challenges that had festered in the long-term care sector for decades: chronic underfunding, severe staffing shortages, outdated infrastructure, and poor oversight contributed to deadly consequences for Ontario's most vulnerable citizens during the pandemic.
Simple things like masking early on, I pleaded with employers to have all of the workers wear, at the very least, surgical masks.
The president of SEIU Healthcare, Charlene Stewart, the union representing over 60,000 frontline healthcare workers in Ontario, says she is sickened by the Ford government's inaction.
Many times he said, the buck stops at him, everything's on the table. Well, by the looks of this report, everything was on the table and disregarded a lot of it.
The Minister of Long-Term Care, Dr. Maleeha Fullerton, released a statement which reads in part, "Since the Commission started its work, the situation in long-term care homes has dramatically improved as the province-insured residents and staff were first in line for vaccines." She further adds, "We launched the largest long-term care staff recruitment and training drive in our province's history as we invest $4.9 billion over 4 years to help create more than 27,000 new positions for PSWs, registered nurses, and registered practical nurses in long-term care."
When you have insufficient staff, then you can provide only insufficient care. So I don't understand how she claims that things have dramatically improved when staffing is at an all-time low.
Honestly, I'm seeing things go back to the pre-COVID exploited conditions that these workers were living with before the pandemic. This week, the government announced that these workers can go back to working more than one job instead of giving them a full-time job that they can work in one place with a decent living wage.
Long-term care advocate Dr. Vivian Stamatopoulos says she wants to see justice for the thousands of lives lost during the pandemic. The report highlighting cases of pure neglect.
When the military arrived into some of these worst-hit homes, they found 26 dead residents who died from dehydration. The government is aware of widespread negligence leading to death, and yet not one home has been penalized, not one license has been revoked, not one person has lost or been resigned or been removed from their post.
Ontario NDP leader Andrea Horwath is calling for urgent action in response to the commission. The advocates we spoke with agree, adding that unethical part-time work needs to end and workers need to be offered better paying full-time jobs, among other recommendations which could be found in the report. We do have a link to the full 322-page commission, which could be found on citynews.ca.